Okay, for our last discussion on health and medicine and the sociology of medicine, we're going to look at the phenomenon of medicalization. This is where everyday life becomes medicalized. What does that mean? Well, pretty simply, medicalization means that aspects of our everyday life are turned into medical problems or become something that are an issue to go see a doctor about and that doctors treat. This can happen in multiple aspects of our lives and is an increasing phenomenon of our society. Um, think about anxiety. Many of us are probably very anxious, and there are lots of reasons to be anxious right now. There's a lot going on. There's a lot of insecurity in the world, and the future is uncertain. But recently in our society, we have been diagnosing people with generalized anxiety disorder. So this is where being in a state of anxiety becomes a medical problem. It's not just someone is anxious, maybe a little overactive in their imagination. Now it's a medical problem. It's labeled a disorder, and it's treated with often a very kind of bland category of drugs, SSRI or selective serotonin reuptake inhibitors. Sadness is another example of this. Today, we recognize that depression is a real mental health issue, but for a long time, it wasn't something that was diagnosed by a doctor and treated as a medical condition. People were seen as gloomy, people were seen as whatever, um, maybe unable to control their emotions, but we didn't think of it as a medical problem that doctors should treat. We looked earlier at how uh, calling something a disease can have a legitimating effect for people, that it's a legitimate thing that's happening to them instead of just a personal problem that they have to deal with. And both of these conditions, depression and anxiety, are a great example of that. We also see this in things like aging. As our bodies age, our bones thin out, our testosterone levels decline, our sex drive kind of doesn't evaporate, but it's not as strong. But today, all of these phenomenon have names: osteoporosis, low testosterone, erectile dysfunction. All of these are things we can go to doctors for to treat. So all of these have become medicalized. What are the drivers of this process? There are actually a number of different ones. Early on in the process, historically speaking, patients are still a pretty big one. Um, Conditions like anxiety disorders, fibromyalgia, we mentioned that in a previous video, which is kind of general pain throughout the body. Chronic fatigue syndrome, people who are constantly tired and falling asleep. All of these were seen as personal problems, but patients would continually go to doctors, go to professionals, and say, "No, this is something wrong. This is a disorder. It's a disease, a pathology." And once the institution names it, then becomes legitimately a problem that doctors can see to and treat. Another key driving factor is doctor advocacy. Um, so doctors are the ones who created bipolar 2 categories. So it used to be, for example, there was only one category, bipolar disorder, which is when you have strong manic symptoms and then strong periods of depression. And you had to be hospitalized for both to be diagnosed as bipolar. But today there are softer criteria because there are people who experience the symptoms of both mania and depression, but it wasn't maybe hospitalizable, but it was still horribly disruptive for their lives. So now we have bipolar 2, which has softer diagnostic categories, softer categories to diagnose it. Attention deficit disorder is maybe a more controversial one. For the record, I'm diagnosed with ADD. This was actually diagnosed by a doctor whose wife couldn't seem to pay attention to her housework. And he found that when he treated her with a stimulant and Ritalin, named after his wife Rita, that she seemed to be able to pay attention much more. So this one's a bit more controversial because it's actually diagnosed based on the effect of a drug. Which leads us into our third driver, which is pharmaceuticalization, where the increasing drive of pharmaceutical companies to treat more and more of our everyday lives with drugs. So not only is it patients that benefit from softening bipolar disorder, but it's pharmaceutical companies that change the label of antipsychotic drugs to mood stabilizers. Um, Depression, well, more and more people diagnosed with depression means more and more people to prescribe pills to. Um, Certainly bodies have less testosterone over time, but if it becomes a disorder called low testosterone, then we can sell testosterone supplements. So pharmaceutical companies have a real built-in drive to see more and more conditions in our life as a medical problem that we can treat with drugs. Medicalization can have global effects. Right? So these pharmaceutical companies um, are, as we say, treating weenies in the core, while in peripheral nations around the world, people are dying from very treatable drug conditions like tuberculosis. As American models of processed food and eating spread more globally and global capitalist system more generally, we also tend to see the spread of things like obesity. Um, so between 1991 and 2014, more and more of the global population has fallen into the category of obesity because of those social determinants of health that the Western models of food have spread globally. So this is a global example of the social determinants of health and illness.